Hi, I'm Jonathan Harper from the University of Washington, and I'm excited to talk to you about some new study findings from the PUSH clinical trial. You may have seen just recently the primary results of the PUSH randomized trial were published in The Lancet. The results brought forth some controversy, really regarding misinterpretation of the findings. We know that achieving the guideline based goal of 2.5 liters of urine a day is very hard. And so PUSH focused on trying to improve the adherence to high fluid intake by randomizing patients to a behavioral intervention arm or to a control arm, which included guideline based care to try to increase one's fluid intake and urine volume. Both arms started with low urine volume of 1.3 liters. Neither made it to that guideline based goal. The behavioral intervention did result in an improved surrogate outcome of increased urine volume compared to the control throughout the study, but it did not result in a decrease in symptomatic stone events. This highlights how difficult it is for contemporary patients to meet that guideline based goal. It also highlights the importance of a clinically relevant outcome, but in no way do these results undermine the importance of fluid intake. And so these new results, we looked further at urine volume and its association with stone recurrence, and we explored the role of urine osmolality. Currently, in practice, we counsel patients to drink 80 to 100 ounces of fluid, but that may not be realistically achievable and it may not be necessary. So, one question is, does an incremental increase in urine volume provide benefit at different levels of baseline urine volume? In terms of urine osmolality, it reflects the overall concentration of the urine, and maybe it's more specific than the one size fits all recommendation for urine volume. And so we combined all the participants and all the adult participants in the PUSH trial, 1,461, into a single arm. They all started with baseline urine volume that was low, below 2 liters. They collected 24-hour urines several times throughout the study at 2 weeks, 6, 12, 18, and 24 months. And so we were interested in achieved urine volume and achieved urine osmolality, and that was defined by the mean of all of the collections during the study period from 2 weeks to 24 months. And then we were interested in the change in urine volume from baseline. Our outcomes were time to first symptomatic stone event, and then a composite outcome of a symptomatic stone event and or a radiographic stone recurrence at 2 years based on CT scan, 2 millimeter growth. And so what we found is that those who were able to have a net increase in urine volume of 438 milliliters, or about 15 ounces, had a 24% less stone recurrence compared to those that did not. And this is in a multivariable model that adjusted for baseline urine volume. So, for example, the patient who starts out at 1 liter and they're able to get up to 1.7 liters, for example, their urine volume is still quote unquote low, but they likely have helped themselves out. And this can be important for feedback for the patient. In terms of urine osmolality, we looked at the achieved urine osmolality in quintiles, and we saw a dose-response relationship throughout all quintiles related to stone recurrence. As urine osmolality is lower or you're more dilute, that's reducing your symptomatic stone recurrence risk across the board. If you just look at the same thing with urine volume across quintiles, while those with the lowest urine volume indeed had lower stone recurrence, you did not see the same dose-response relationship across all quintiles for urine volume. So putting this in context, we know that as you increase your urine volume, your urine becomes more dilute in general, or your urine osmolality is lower. But at any given urine volume, there's a wide range of urine osmolality. So knowing both these together can be very helpful. If you have patients that have low urine volume, say between 1.5 to 2 liters, many are going to have dilute urine, and which would be important to know. At the same time, many patients who have quote unquote excellent urine volume of 2.5, even 3 liters, have concentrated urine. Again, that would be really helpful to know, so you can know maybe you need to be more aggressive about other aspects of their stone prevention. So, thank you.